Well, folks, if we could get your attention, we have one more, I'll call it a mini session before lunch, but it's a very important discussion, and we're delighted, to welcome our good colleague and partner, Dr. Janet Wright, the Executive Director of the Million Hearts Initiative. Dr. Wright is joining us today to provide an update on Million Hearts 2020 and where things stand, where we can contribute and make results even more powerful than they have been to date. We had, as you may know, Janet, a compelling study presented this morning, a survey on some of the more challenging trends, but we're anxious to hear how you're working with us and many of our partners to turn those around. So thank you for joining us this morning.
It is my pleasure and an honor to be with all of you. I see so many friends and, oh, hey, friends that I haven't seen in a while. And I think first I want to convey gratitude from the entire Million Hearts team. We are CDC and CMS coming together and lots of wonderful private partners and other federal partners as well. So thank you for the work that you're doing, and thank you for getting us to this point. I'm so grateful to Steve Sidney and the Forum for producing that wonderful report that, to me, concisely crystallizes the challenges we have ahead of us. And the time is now, obviously, to redouble our efforts. And I want to echo what Sergeant Major Troxell said about being outside the box. It's funny to be sitting potentially representing federal agencies and asking us all to think outside the box. We might not be known for that, but the time is now. And I'll just go over maybe a couple of places in Million Hearts that are new, because I know all of you have been putting your shoulders to the Million Hearts wheel for the last 5 years. But before I do, I'll just say again how grateful I am that your work has maintained its momentum and likely accelerated over the last year, while those of us in federal service have been understanding and adapting to the priorities of new leadership. That's been an interesting process. I know you'll hear from the Surgeon General later today, but we are still hearing a strong signal about support for cardiovascular disease prevention, and even perhaps a little broadening of that, making sure that we are incorporating an interest in preventing diabetes and better managing diabetes, as well as incorporating a focus on kidney disease for all the reasons that you know. It is, after all, largely a vascular problem. So thank you for maintaining the momentum as we adapt to new leadership. Second thing I want to say is just highlight the pieces of Million Hearts that are new. Physical activity has been added. Should we say amen and hallelujah? I know we talked about this a little bit last year, but it's been added over on our public health and public policy side so that we contribute to healthy communities and the structure and the access to places for physical activity. Again, I love what Sergeant Major Troxell said about thinking outside the box. One of the suggestions we heard for our cardiac rehab work, Sue, I think you were there when this was said, that in pharmacies, your local neighborhood pharmacy, you need to get your meds, your toilet paper, and your cardiac rehab session. That is thinking outside the box. So new in Million Hearts is this focus on physical activity on the clinical side and the community side. Second is cardiac rehab. Underutilized, profoundly effective to protect people from subsequent events, and definitely going to be a big part of our work going forward. And then the third area that feels new and is new is engaging people in heart-healthy behavior. And that's initiated in a clinical setting. How can we help people better manage their conditions and have them help themselves in preventing new ones? So we're still fleshing out what that means, but look forward to working with you on that. We've developed a deeper interest this time in subsets of the population with a very high burden of disease. And I know we've already had conversations with many of you to date about those priority populations. They are African Americans and Blacks with hypertension, people who've already had an event and aren't getting the treatment and health advice that can help them prevent a second. those in the 35 to 64-year-old age group, where, as you well know, we're seeing event rates rise. And then the final priority group for us are individuals with a substance abuse problem or mental illness because of the very high smoking rates. And we think together we can make headway and help more people stop smoking. So that's a summary from me. I thought we might leave residual minutes for advice from you to me or any questions that I might answer. Hi.
Questions for Dr. Wright? Let me just get that started, if I may.
Great.
You probably saw the title of our session today, Pathways to Engagement.
Yes.
It was one of the points that you made, and we've now, it says 80 members, but I believe we've surpassed 90. And we're really focused on new types of relationships as well. Mm-hmm. Sectors of industry, we've heard from some of those today. Right. Do you see any particular strategies that we ought to focus on in broadening our engagement?
So Dave, you threw me a curve at the last minute because I thought you were talking about the sectors. I'll just share with you, we think in Million Hearts, we didn't get to move the needle as much as we'd like. Our collective action didn't move the needle. We saw 1% per year improvement in blood pressure control, maybe 2% improvement in statin use over the 5 years. It's not enough. It's not fast enough. We're not getting to enough people. When we looked back, we did not engage employers who are clearly invested in the health of their flock, of their employees. In fact, their success as businesses depend on the health of their employees. But we didn't get in to work with them. Mm-hmm. The other sector for us are health systems and hospitals, and we think the environment and the issues that made that more difficult in the past are really looking more favorable. In terms of the interventions and the things that work, I think you're most likely on the right track. Mm-hmm. And of course, with the forum and all of the partners in the forum, your focus and the set of interventions you can get underway are much broader than the little SWAT team of Million Hearts can do. But I think if you took at least the things that have been identified and that we're proposing and set those in motion across all of your sectors, we're bound to see that trend tip down again.
Well, I was emphasizing sectors, not trying to throw a curveball. Oh. So I appreciate the emphasis on employers and health systems, yep. Two areas that we are looking to grow in. So other questions for Dr. Wright, please.
Sue.
I'm Susan Campbell with Women Heart, National Coalition for Women with Heart Disease. It's always a pleasure to have you give us your wisdom, Janet. But I'm interested in the group of 35 to 64-year-olds, which sort of feels like everybody. And what can we do that's new with them that we're not doing already to get the message across and to try to change behaviors?
Yeah, Sue, I think I'm not in a position to teach. I'm in a position to learn and to share what we've learned. What we can tell you is that many of the people in that age group meet the scientific guidelines for treatment, not only with lifestyle modification, but also with medications for statin and blood pressure, and they're not getting them. And what we don't know is, are they not getting them because they're not being offered, or they're not getting them because they were offered and they're choosing not to take them? But those people are going at risk. As you know, physical activity is lower than we'd like, and certainly so in that busy age group. So I think there are things that we know work, but are not being implemented, and not implemented across the entire population. Yes, Kat.
Well, I love to follow Susan Campbell, and it's wonderful to see you, Dr. Wright. We're at the FH, I'm Kat Davis Ahmed with the Familial Hypercholesterolemia Foundation. FH is a genetic disorder that causes early heart disease and increases risk for early heart disease, regardless of all the wonderful interventions that we've been talking about today, which of course are important for everybody. We're very excited to see the emphasis on that age population, because we know that 90% of people with FH are not diagnosed, and that there is an opportunity for heart disease prevention with statin use and other interventions. So I guess my question then is, how might that factor in to the efforts of Million Hearts, especially given that FH is a Tier 1 condition according to the CDC, along with BRCA and Lynch syndrome? Thank you.
No, thank you, Kat, and thank you for the work that you and the foundation are doing. One of the things I'm excited about in that particular area is the widespread implementation of electronic algorithms to detect people with LDLs of 190 or above. They're everywhere, well, not everywhere, but they're in many places, and just like people with undiagnosed hypertension, they're often seeing a clinician not getting that trigger, not being identified. So we hope that we could take the work that's been done in finding hypertensives hiding in plain sight and apply that to those with very high LDLs.
Great. We have time for a couple more questions. Please.
Hi, I'm Amy Edmonds. I'm with Young Stroke, and we are a patient advocacy organization that benefits stroke survivors under the age of 65. I would like to encourage everyone present today to please go home and to try to get your home state to publish the numbers of stroke survivors under 65. One of the most important things that we can do is to engage people in the conversation. And in order to do that, we must have credible numbers being reported. I'm delighted to report that South Carolina, in spite of all of our health disparities, this year, for the very first time, included the rate of stroke among the population under the age of 65 on our state fact sheets. And we did that in 3 ways, both by showing the rate of stroke under 65 among women, then among minorities, and then as a part of the total population. That's significant because it's very difficult to go and have a conversation with the legislature when there's no credible numbers to refer them to. And so it's really important to get that information in print in order to share it and to have researchers to then become interested in doing work around the problem. So please become a part of the solution. Thank you.
Janet, does that resonate with you?
Absolutely,
Yeah.
and thank you for the work that you're doing to make those data known and to get us into action in that group.
Neil?
Dr.
Darn.
Lamar.
Thank you very much for being here. It's always a pleasure to see you, to hear about the progress of Million Hearts. I'm interested to know your thoughts based on the experience that you've had in communities, in work sites, in national organizations with their local organizations. Thank you.
If you had your druthers over the next 10 years, what would you see as the strategies most promising to enable you to move that needle? Intensifying efforts locally, scaling up one or another of these avenues of implementation, wider partnerships with national organizations? Where do you think Million Hearts will have the greatest impact over the next 5 to 10 years? And how can we help you to get there?
Darwin, I love you so much. It's being recorded, right? We're both married people, happily married people, but I do love you so much. And so I think you would agree with me that all of those things need to happen. Where Million Hearts, at least to date, it seems to me that the contribution of the collective effort of Million Hearts has been to reduce the signal to noise ratio about what works, giving people almost the luxury to focus on very high impact, high value actions, even though we know we need to do it all, but we sort of lifted up some things and tried to make it easier for people to at least decide what they can do. See themselves in the work and pick the things that meet their mission and their bandwidth and their priorities. So I think that this effort of Million Hearts can continue to play that role. I hope with what I am seeing as very authentic engagement on the CMS side of the family, in addition to the long-standing engagement at CDC, when I'm seeing the CMS engagement, what I see, I'm sort of half full on the glass thing, just attitude-wise, but what I see is the ability to spread and scale, at least through the CMS-funded vehicles and networks, and that makes me very optimistic.
Janet, thank you for joining us for this mini session.
David, I got to
Okay.
say one more thing. Soon, in some form of communication near you, we'll be announcing this year's high blood pressure control champions. CDC has run this program for the last 4 years. We're adding a new batch of fantastic folks. I hope some of them are working. I hope they belong to you or other networks that you're connected to, and I hope you'll help celebrate their success.
We appreciate you being here today
you.
very much. Thank you.